The research is looking really good in the context of vaccines. The vaccines are performing really well in terms of what we need them to do. So they are preventing most people from being hospitalized and having the very, very severe effects of COVID, which is absolutely fantastic news. The most important #1 goal of vaccination, in my opinion, is to prevent severe illness and death. It's great if you can get vaccines that can prevent infection completely or prevent transmission of infection. But overall, what we really don't want to see is people getting long COVID, people being hospitalized with COVID, and people dying of COVID. The vaccine is proving really effective at preventing serious illness and death, and we're seeing quite a lot of evidence for that. We're seeing remarkable reductions in hospitalization in vaccinated people compared with unvaccinated people, and similarly, we're seeing the same sorts of trends for deaths due to COVID. So if you are not vaccinated, you are much, much more likely to get severe effects from COVID infection. For an effective response to COVID, we need our immune response to work very well at fighting the infection. And there's several parts that are needed for that. Antibodies are one part, but another part is provided by things called T cells and things called memory cells. Now, T cells can kill the virus, and memory cells have got all the recipes to be able to quickly kill the virus, whether it be making antibodies or making more of those killer T cells. We know that the memory cells and the T cells are looking really good in terms of vaccination. However, we are seeing evidence that some people are getting lower levels of antibodies over time, but that doesn't mean that they cannot fight the infection. The question as to whether we have boosters is a really difficult one at the moment. The evidence is that we are getting a really good T cell response, a good memory response. These are also very, very important things to help fight the infection. And we are not seeing as much hospitalization or death from COVID. But for some more vulnerable people, such as older people who might never make such a good immune response, then perhaps it is important that they have boosters. But at the moment, we have a real dire situation across the world where a lot of people have not even received their first vaccine. And that means they are vulnerable to the virus, and that means the virus can thrive. And whilst the virus can thrive in parts of the world, that leaves us all vulnerable to the disease. So perhaps we should be looking to vaccinate the world before we start vaccinating ourselves all over again. Vaccines are just one of the ways that we can keep ourselves safe against COVID. There are lots of things that we can do to reduce our risks. Wearing face masks can be really helpful, particularly in confined spaces. Also, looking at the types of activities that you do and how busy a space is. Is it well ventilated? Are there a lot of people there? Are you going to be there for a long time? These are all things that can change your risk to the disease. It's an airborne infection, and there are many, many things that we can do to reduce the likelihood of spreading the disease and also catching the disease.